Hi, Duluth moms. It's Andrea here today. I am just popping on to have a conversation with Michelle Sturm from St. Luke's. She is a licensed advanced practice esthetician at at St. Luke's Rejuvenation Center. And if you remember from our Bloom event, we had exciting posts in there announcing the opening of their new Rejuvenation Center. So Michelle will be able to talk about their services and what she has to offer. She will ask her questions about moms changing skin during pregnancy. And then also we'll get some good tips for that terrible winter weather that just bites our skin, how to protect our skin. So I'm going to bring in Michelle and she can introduce herself.
Hey,
Michelle.
how's it going?
Good. Thanks for being here today.
Yeah, absolutely. Thanks for having me.
Yeah. You just
So
came straight from patients?
I did.
Yeah.
I had lovely lines on the face from wearing masks, but I
Working
don't
hard.
sense. It's just part of the job, which is exciting that we can treat patients and we're safe treating patients with our N95s and all of our PPE. So yeah,
Great. Has COVID put a damper on services you're able to offer at the Rejuvenation Center? Or are you able to offer?
not at all yet, which is fantastic. We're
Good.
absolutely everything we were able to before.
Okay.
So that's super exciting. And patients feel safe coming in, they feel comfortable coming in. We're just masked up and gowned up and ready to rock. So it's
Yeah.
been
Good. What is your top service that you provide? Is there one?
this time of the year, I'm doing a lot of BBL, which is our broadband light for pigmentation,
Oh,
redness, sunspots, things like that. A
yeah.
lot of facials, people are feeling dry, breaking out with maskne, the acne
Mhm.
related to mask wearing. So that's been one of my top treatments as well. So kind of a good variety.
Yeah. Yeah, great. I know, again, referencing Bloom, when we had moms look through the services in the virtual event, I asked the moms which one was their favorite or which one would they go, to receive, and almost all of them said waxing. They wanted
Or go wrong.
waxing. So that is a service. People wouldn't think to, go to St. Luke's maybe for waxing, but you do offer that.
Yes, we do.
Yeah.
Head to toe, everything in between. So the brows, the underarms, bikini, legs, you can get it all done right in the Rejuvenation Center, which is fun. It's
Yeah.
we pretty much offer everything that a spa would, except for medical grade products.
Okay. That's awesome. Speaking of products, do you have any product recommendations for moms who are nursing or breastfeeding that when they may have to look at the ingredients more carefully or be more aware of what they're putting on their skin?
Absolutely. So I'm sure their doctors have told them keep the retinols out. Sometimes
Mm.
or sometimes new moms and pregnant moms will end up with some extra acne with the hormone changes and things. So you always want to be gentle to your skin. Don't use anything harsh. We have some awesome products from Innovative Skincare, which is IS Clinical is the name that it goes by, and they have products that are safe for breastfeeding moms, for pregnant moms. They help correct the skin as well as protect the skin, and they won't go deep into an cellular level to where they're going to harm anyone.
Hmm.
So it's a great option.
Cool. That I think will put a lot of moms' minds at ease if they want to either continue treatments they're already getting when they're pregnant, or if they want to try something new, if they have new, conditions that pop up.
Absolutely.
And I know we don't do these videos to like make moms or women feel bad about their skin or their appearance. That is not what it is at all. It's just we want to touch on aspects of health
Absolutely.
kind of holistically. Like your skin is a huge organ and it's the first thing that, touches your pillow and you wake up in the morning, and it has a lot of changes that can happen. So
Definitely.
yeah, that's
I have
why.
3 kiddos, so being through 3 full-term pregnancies and having my skin go. One pregnancy, it was haywire and I had acne all over. And then the next one, it started very dry. And so it's been a neat experience learning what would work best for my skin and helping patients learn as well throughout my experience in both aspects of that. So, yeah, we just want to look the best we can and feel the best we can
Mhm.
with all the changes in the body and changes in the skin. So, anything I can do to help, I'm always open for that.
That's great. What encouragement do you have for moms who may be frustrated with like postpartum skin or even like post miscarriage? You don't realize like how much your hormones play into effect. And it's easy to feel antsy about, oh my gosh, it's 6 months after I had this baby. Why do I still have, XYZ? Do you have anything to encourage moms or to encourage them to be patient with their skin, or when can they maybe really know that they should come in and be seen?
So definitely be patient, drink a ton of water, try to get as much sleep as possible, which we all know is not the easiest, especially right after the baby and things. And
Yeah.
so taking care of yourself that way can definitely help. If you're starting to get some really bad breakouts, I always recommend first step is calling dermatology.
Hmm.
Check in with them. They can kind of help direct too if it's something that needs to be that can be treated with light facials and things like that. Then they send it my way. If it's something that's a bit more aggressive that their acne is doing, or they're ending up with deeper cystic acne, that's definitely where they would want to start. And then my direction after that. I don't even know if that answered your
Yeah.
question.
Yeah, it does. I didn't realize, I guess, that the departments were separate, which leads to another good point. Um, to see you at St. Luke's Rejuvenation Center, you do not need a referral because insurance does not process those treatments.
Correct.
But
Yes.
if you were to start the dermatology route, you may need a referral for that, maybe from your OB or your primary care.
I think it all depends on your insurance. So
Okay.
sometimes you don't. At least that was my last understanding. I'm not sure if
Mhm.
that's changed or not. But
Yeah.
yeah, if your skin is going a little bit more haywire, derm is a great place to start as well. If you're getting the cystic things, start there. If it's more just kind of minimal breakouts and dryness, head my way.
Okay, that's great to know. I didn't even realize that. I needed that piece of info too. Awesome. Well, do you have any more tips or advice for the winter season for us when we have you mentioned the mask knee, we have our masks on, we have coat collars that are rubbing, hats, our hair probably has different oils too, compensating for
Absolutely.
dryness. What tips do you have for us in that area?
So for the same thing, drink a ton of water. We all being living up here, it's very dry, compromised air. It's things dry out much quicker, but then you can still end up with acne on top of your dry skin. And so it'll be interesting to see what this winter brings with the mask knee aspect.
Mm,
Um, so yeah, I haven't even obviously experienced that
yeah.
myself. So keeping your hair away from your face is a good thing to help, so you're not ending up with extra oils around there. Also, under your masks, that we're trying to say, keep your lipsticks off if you don't need them, because it's just kind of clog things up and move things around. So avoid that. Sunscreen is huge. Even though it's winter, so we don't think we're out in the sun a lot or anything like that. Keep your SPF on, so that's going to protect your skin,
Okay.
even if you're just focusing more on SPF through here and not through here from where you're wearing your mask. That'll also help protect your skin throughout the winter, because it could be a long one and we want to be outside playing, but we also don't want to compromise too much of our own skin. And same, be gentle, hydrate, sunscreen. Those are my big things to try to keep our skin healthy as can be. Facials are great in the winter. We do microdermabrasion. That can also be great to kind of exfoliate some of those dead skin cells, and then add some hydration on top with a hydrating mask. Facials, same thing. Go through and exfoliate with a light chemical that's safe,
Hmm.
and toss on some hydration for that too. So
Awesome. And you have the hydration mask, any type of product at the center?
we sell
Mhm.
four different skincare lines. IS Clinical is our most gentle, most natural line, paraben free, gluten free, safe for pregnant and breastfeeding moms. Great for hydration, for acne, those types of things. Elta MD is our top by far sunscreen line. I absolutely love it. I'm super excited that we have that. Zeo Skin Health is another one that we carry. That's a little bit more aggressive, and so I really wouldn't typically aim that towards definitely not towards a mom that's doing breastfeeding or a mom that's pregnant at this moment. And then Revision Skincare is also another one that we have that has great products that can add hydration to the skin, help minimize pigment. Yeah, some good options. We have options for every person, every skin type, every situation.
That sounds great. Now I know if I get discouraged this winter where I can go to
Well,
get help. Well, I am going to pop this up on the screen for you guys. If you want to learn more about services at the Rejuvenation Center at St. Luke's, you can visit their Facebook page, probably for the most up to date and current information, but also check out their website. I'll put that in the description of this video here, along with a couple, I guess, little clip notes and tips. I'll put that there. um, but thank you, Michelle, so much for being here with us today.
Absolutely.
And maybe we'll see
One more
you.
little fun thing
Yeah.
too. Virtual visits. So we can do
Yeah.
virtual
Oh,
So new moms, busy moms, all of that fun stuff. You don't have to make an appointment to come in. We can sit down via Zoom, FaceTime types of things too, and do a consult this
okay.
way. And so, yeah, get you going in the right direction with products. I can answer any questions or help any way that I can via virtually if you just sometimes don't have time to swing in. So
Yeah.
it's
Oh, that's great. That is really helpful for moms for sure.
definitely.
Yeah. Well, thanks so much for all the tips and all the information, and most likely we'll see you soon.
Thanks for having
Thanks.